Sitaram, and a pleasant good morning to all of our viewers and listeners, and welcome to another edition of the program Addiction and Recovery. I am your moderator this morning, Jason Kalu, and join me as we welcome the host to the program Addiction and Recovery, Mr. Ramnawis Dwarka. Sitaram, Jason.
I'm Jason, and thank you very much for hosting me this morning. Let me join with you in welcoming all our listeners, both locally and abroad, and those people who are following us on YouTube, on Facebook, and the social media. I know today is a very beautiful day in Trinidad. The sun is out. I know we had some flooding yesterday, and I have had several requests, Jason, from people, and I've seen a lot of patients late. I've been seeing a lot of patients lately who, because of some problem, health, psychological, social problems, are having problems with sleep. I know we have spoken about insomnia in the past to some extent, but today I'm dedicating the program to looking at this because there are this has several implications for people in recovery. To start with, alcohol is a sedative, and sedative, for those people who are not aware, a sedative is something that makes us feel sleepy. Now, the body produces its own sedatives naturally, but we can take things from outside, synthetic things. So, alcohol is one of those things that can make us feel sleepy. And as a person continues to drink and they become dependent on alcohol, when they stop drinking or they're attempting to stop drinking, they naturally, most of the time, insomnia is one of those withdrawal symptoms that accompany recovery from alcoholism. However, that is only one of the reasons. There are so many other reasons that could be rooted not only in biological factors. There are psychological factors that could cause a person not to sleep. That is to say, if you're going through a stressful period, you're having some trauma, psychological trauma, estrangement is one of them. What we in Trinidad here call tabanca. That could also cause you to have difficulty sleeping. And then financial problems, loss of a job. Then there are other physical problems not rooted in drug addiction. Like, for instance, you might have suffered some injury, or you are suffering with some illness now that is causing you pain, physical pain. You can't sleep on that side you are accustomed to sleeping. Or as you turn in the bed, you get pain from that limb or that arm or that part of your body, and it wakes you up so that you're not getting your full amount of sleep. You are unable to sleep. And then there could be other factors like illnesses that causes one. Like, for instance, if you're diabetic and you have to get up several times in the night now because your body is trying to flush the system of the excess sugars that is in the blood. And every time you get up, you break your sleep, you have to go to the washroom and you come back. A lot of people now have difficulty going back to sleep. And that could be a function of not only physical illness, but for instance, let me explain this. During the day, Jason, we are preoccupied with all those things that we have to do. You understand? So that keeps our minds engaged. It keeps us challenged, and so that we don't have to focus on certain things. But when we go to sleep in the night and the world is asleep around us, there's nothing really to distract us. Those would be the times when we wake up, or for whatever reason, we have difficulty going back to sleep, because now all those things that we suppressed, not only from our daily life, but there could have been things from early childhood. There could have been trauma that associated with abuse, or fear associated with some experience that we have had, or anticipated fear that we might have, that we are going to be, we are going to suffer some psychological loss, or loss of a relationship. And there are all these kinds of fears, like the whole society went through the fear recently because of the COVID, And a lot of people relate to fear differently. There are those people who have a strong faith rooted in their belief system, and they are able to probably deal with it much better than those people who, for whatever little reason, they become fearful. And now you lie down there and you're trying to sleep, and you can't because you're processing all of these fears, these anxieties, these stressful factors that are currently engaging your life. And the problem is, let me say this at the outset, it might sound like a joke, but insomnia is that inability to sleep. That is, to drop asleep in the first place, or if we become awake in the night, to have difficulty to go back to sleep. And there's a lot of people might want to ask, how many hours you have to not be able to sleep to be diagnosed with insomnia. But there's no fixed hours because our sleep requirements are different from one person to the other. Generally, it is suggested in some of the literature that an adult should get between about 7 hours sleep. But that is not fixed in concrete. There are people who can get by with much less sleep, and there are some people who need much more than that. Now, sleep is a very good indicator as well of the person's mental health. For instance, in my practice, you can be sure if I am doing an assessment, I'm going to ask 3 questions of all my patients, especially teenagers, young children. I would want to know how you're eating, your appetite, if you have, what is this condition with your appetite. I'll want to know about your sleep. How are you sleeping? And strange enough, a lot of people might want to know, but I'll also want to know your body elimination practices. That is, how often you're going to the toilet. These 3 questions, Jason, and I'm saying this for our brothers and sisters out there, these are 3 things that all human beings should pay attention to in themselves and in the people around them. Because if a human being is suffering with any extreme problem, whether it be illness, whether it be physical illness, whether it be psychological distress, social issues, financial issues, whatever issues, once there's stress in the body, once there's those 3 factors, those 3 indicators will tell you that something is wrong somewhere. If the person is having difficulty to sleep, there might be a problem, as I mentioned earlier on, with their physical abilities, pain and all of that, or illness. Or they may be psychologically distressed. A child might be having trouble with their homework and now be afraid to go to school. And with children especially, you might have an additional problem of what you call enuresis, where all of a sudden they start wetting the bed in the night. And that could be indicated that they are either being bullied in school or they're having some trouble somewhere. So sleep is a very good indicator. Now, there are people who tell you, I have no problem with sleep at all. And they could sleep 10, 12 hours a day. But I'm thinking that that is a very healthy thing. But no, it may be a sign of depression. Because people who are clinically depressed, that's one of the things that they want to do all the time. They want to sleep so that they could escape having to deal with the reality of their situation. So sleep deprivation and too much sleep is or has a lot of meaning for people like myself and psychologists and so on. This tells us something is wrong somewhere. You understand? Appetite as well. The person, people who are depressed, stressed out, they have a tendency to want to eat all the time. It's called comfort eating. And they put on weight and they have a preference for sweet things because they want quick energy to the brain because when they are awake, they are engaging with so many stressful things. Now, if it really gets bad, Jason, they lose their appetite completely. And that has been an age-old lay diagnosis. People will watch you and say, boy, What's going on with you? How you getting so thin? You understand? Mothers especially watch their sons, and say, boy, you got it, like something wrong with you, what's happening? Why are you losing all this weight? Because if you're really chronically depressed or anxious or whatever, you could start losing weight. You can lose your appetite. Now, an extreme case of that is like people who are experiencing something for the first time. First time you're going to travel on a plane, and what happens? You immediately get diarrhea. That's an extreme case of wanting to rush to the bathroom, or facing some situation. So sleep has meaning. Whether you're sleeping too much or you're not sleeping, it has meaning for people who, like myself, who are doing evaluation. But it is important for our lay public, our brothers and sisters out there, to also have this knowledge so they can pick up things very early. Then that sleep, appetite, and going to the toilet. Well, of course, constipation, there's something called encopresis and enuresis, I mentioned before, that can also indicate psychological distress. But it can also tell you about physical problems, how your body, how the body is metabolizing things, how it is processing the food. You understand? It will also, of course, tell you whether you're eating the right things or you're not eating the right things. And if you're not eating the right things, it will have implications for your health. So all of these things are tied into one. It may look very innocent, are you sleeping and are you eating? But it is very, very important. Sleep is just as important as the food we eat. Our body needs the rest because if you're eating the food and you're not during sleep, the body is now repairing all the damage that you did to all the tissues during the day. And for younger people in their teens, sleep is the time when the body grow and repair itself, but you are growing, so you need much more sleep. Which brings me to the question of a lot of people I have found in my practice and experience, they just don't know how much sleep they need to get because we all came into this world, Jason. And at the very outset, as we were born, we were sleeping like 23 hours because all we were doing is waking up to breastfeed or to eat and then go back to sleep because the emphasis was on growing. But as we grow and we get older and older, we need less sleep. So you'd find in primary school and so on, yeah, we could still sleep like 10, 12, 14 hours sometimes on the weekend. But as we get to this age, like I am now, if I get between 5 to 6 hours sleep, because I'm not growing anymore, and especially if I'm living a sedentary life, I'm working in the office, I will not need as much sleep as a person who's working out there in the fields, doing laborious work and so on. So for people like myself, if I want to get my 7 hours sleep, I have to get some exercise because sleep is not only a function of in the early stages of growing the body and repairing the tissues, but it is also a function of giving the body rest as well because the body has to rest and repair itself for the next day's work. So if I am not doing much laborious work, I will not need as much rest. Conversely, if I want to sleep better, all I have to do is to do some exercise. My body will start requiring the sleep. Now, that is the physical side of it. However, if I am going through psychological distress because of maybe financial problems or relationship problems or work problems or whatever, then even though I'm doing the physical exercise, which will help, when I wake up in the night, I will have trouble to go back to sleep because now is the time these thoughts will come in the mind, and all human beings, especially if you're an ambitious person, you will want to come to some resolution of that problem. So you will be chasing solutions in your mind all till dead ends, and what will happen is once a person starts becoming stressful in the night after they wake up, the body will start to secrete adrenaline. Now, adrenaline is several times more potent as a stimulant than even coffee. So what would happen is you start lying down there and you're sweating even though the air condition on because you are tense and anxious about what going through the mind. And you'll have once the body secretes the adrenaline, then you can't go to sleep. You understand? And you'll have to probably wait. Some people, the more they worry about it, is the less able they are to sleep. So there's a, as I mentioned earlier, there's a little saying that the cure for insomnia is that you shouldn't lose any sleep over it. It sounds contradictory, but meaning once you start worrying about not being able to sleep, you will have trouble to sleep. You'll start to get anxious. But a person who has to get up to go to work in the morning and from experience know that they will be a mess because if they didn't get sleep in the night, then they'll start feeling sleepy on the job. And that you can't deal with that because if you are doing a job like you are doing, Jason, you can't drop asleep in this interview, right? Although I know I have a voice that could put people to sleep, but it will not look good for you. So you have to get your night's sleep. All right. So, I mean, there's so many other reasons: physical, psychological, medical, relationship, financial, that could feed into a person's insomnia. But let's get to all right, for whatever reason you are suffering with insomnia, you have trouble to sleep. I know a lot of people, their first line is to go to the doctor. And as I say this, the truth is, for psychological problems, one should really go to a psychiatrist. Psychiatrists are more, that is their field of making evaluation and assessment and prescribing psychotropic drugs. But in Trinidad, I know that it has been the practice for even general practitioners to prescribe psychotropic drugs. That is, to prescribe what we call sleeping pills. You understand? And I want to say to our colleagues, my colleagues in the helping profession, I mean, while we need to register in our mind the great work that they are doing for the society, the doctors and the people, the psychiatrists and all of that. But anyone, to my mind, and this is my opinion, based on my experience working in the field of psychiatry as a psychiatric social worker, if one prescribes psychotropic drugs, mind altering substances for a patient, you have a responsibility, Jason, to work out an exit strategy because nobody should be put on these drugs for the rest of their life. If you're going to be, because what happens if you start taking sleeping pills? Yeah, I know a lot of people have even prescribing for themselves. I've heard it said, you lost a loved one, somebody in the crowd, well, look, get a person a sleeping pills, to tie them over this stress and so on. And yeah, it works because it takes them out of having to deal with the reality, knocks them out to sleep. But you could be starting a bigger problem for that person because these psychotropic drugs, within days you can become dependent on them. And when I say dependence, I don't only mean physical dependence. A person might take a little while longer for the body to become physically dependent on a drug, but the mere thought of that this drug can help me to relieve this distress can immediately make the person learn to become dependent on it. So dependence is not only physical, although a lot of times medicines see, addiction as being physical addiction. But addiction is also psychological, that people can become addicted to placebos. You understand? Because the mind learns these things. So this is something that I would warn people out there not to do. Don't self-prescribe psychotropic drugs for yourself. If you are still using any sleeping pills and anti drugs for your anxiety and all of that, you need to work out a way to get off these things with your doctor. Because, and the doctors, I know generally, Jason, doctors do tell the patients, look, I'm only giving you this for a week to help you, to tide you over this situation. But we Trinidadians, we are too bright for our own good. What we do, we read the label, we see the name of the pill, and we go to some of these not so ethical pharmacies who are operating like businesses, and we find some way around under the table or somehow, to get the drug. So we don't have to go pay the doctor fee anymore. And what we are doing there, we are setting up ourselves for a lifetime of problems, because what is going to happen, Jason, is at first 2 milligrams will put you to sleep. But then in a little while, the body develops what is called tolerance. Then you have to take 5 milligrams. And if you fast track that story, I have had patients here who using up to 100 milligrams and still can't get sleep, and they could kill themselves with these things. They can overdose on these things. And every one of these drugs, that psychotropic drugs, we have a saying, Jason, whatever goes up must comes down. That is not only true in physics, that is true across the board. So whatever makes you high, you can't stay there. You wouldn't stay there in that euphoria or whatever comfort zone the pills took you. It is going to wear off. And when it wear off, you are going to go to a place worse than where you were before. Because now you have the original situation with the insomnia, the inability to sleep. But now, because of the drugs, you start suffering with other withdrawal symptoms like anxiety, panic attacks, heart palpitations, uh, muscular pains. It can reach to a point where you start seeing and hearing things that are not there. You feel like the earth under your foot is moving away, like buildings are going to fall on you. I had a maxi taxi driver who couldn't drive his maxi again after taking these sleeping pills, because he used to feel like the maxi is going to topple over with him. Can you imagine you driving and you getting that feel and you're pulling away from things that are not there, and you have a whole maxi taxi full of people? What's going to happen? You understand? So it is a serious thing. I'm saying, because a lot of people, and this is especially predominant with women. I'm not scapegoating women, but it is easier for men to go in the bar, drink, get drunk, come home and sleep. But women have been for a long time. And because their body is smaller and unable to metabolize things, they become much more vulnerable to these psychotropic drugs. So you find a lot of wives who are in pathological relationships, who are having domestic problems because of their husband's alcoholism or infidelity and all of those. A lot of them, friends say, well, I've been taking this, and so that they just take it and they knock off and go on to sleep. Nobody knows, because when you take these sleeping pills, nobody smells your breath next day and all of that. You look down. And if the doctor prescribe it, I mean, we have license to take it. And I am seeing a lot, and this is why I've chose to speak about this morning. I'm seeing a lot of patients who are coming to me with these, even medical professionals, nurses and doctors as well, because they have access to the medication and they start using it for utilitarian purposes and then become dependent on it, and now can't get off it themselves. I have been using acupuncture, auricular acupuncture, to help a lot of people to come off these psychotropic drugs, whether they be for anxiety or depression. But it takes time, and I'll tell you, it is several times more difficult to come off prescription pills than it is to come off illicit drugs and alcohol and these things. Because these little innocent looking tablets are very, very powerful, and they are calculated, they have been researched so that by the time one starts to wear off, you have to take the other one. And they are prescribed like that. So you are all, night and day, you are drugged. And this is why some people on some psychotropic drugs, they can't function. They're like walking zombies. And if you visit Siddhan's hospital, you'll understand what I'm talking about. You understand? All right, so now let's get to the solution. How do you deal with it? For whatever reason, you start having problems to sleep. Well, let me give a few tips on what we can do. As I mentioned earlier on, if we exercise, a little half an hour of exercise of any kind, walking, gym, yoga, any one of these things, it will help you to get a better night's sleep. Secondly, of course, common sense will tell you, Jason, you need to make your your bedroom sleep conducive. That is, man, you don't want mosquitoes and the place hot and you're sweating and all of that. And sometimes you have a partner in the room who's snoring, and if they drop asleep before you, you're in trouble. So you need to fix all of those things. And another what one needs to do too is, as I said, exercise. A warm bath before bedtime helps. There are certain foods like a warm glass of milk, things like that, that will induce sleep. But don't go in your bed and wait to sleep. If you're a person suffering with insomnia, Jason, if once you go into bed and lie down, and after 5 minutes you don't drop asleep, you know what happens? The old tapes start playing in your head. That is to say, you're going to be thinking, oh God, it's one of those nights again, and I will not be able to sleep. And when I not sleep, what will happen tomorrow? I will not be able to go to work. And once you start thinking like that, you start to become anxious, and the adrenaline will start to flow. And then you can't sleep. You'll start to sweat. So what do? You watch your TV, you read your papers, you do all of those things. And when you start to feel sleepy, then go into bed. All right. Now, a lot of people treat their bedroom as their office as well. No, please. Your bedroom is for sleeping, and your mind should associate the bedroom with sleep. But it shouldn't be your living room and your recreation room and your office and all of that, because the mind sometimes associate activity with it with certain places. I'll give you an example of there's a little place in the office where you work, they call it toilet, right? And as soon as one goes in there and sit, the mind know already this is the place for this. And it happens. That's what I'm talking about. It will not happen. You go walk the whole of Annapurna and for a spin and all that. Nothing will happen because those are not the places for that. But from the time you go and sit in that little cubicle in the office, in the building, it happens because the mind associate that with that activity. So too, your mind should be able to associate sleep with the bed. All right, so you make your bed, use a mosquito net if you have to, your AC if you're lucky, or fan, have the place well ventilated. If you have somebody who's snoring, you discuss it with them, and so that they go to sleep after you, make sure you drop asleep. Or they probably sleep temporarily in another room until you regulate your sleep, because you will be able to regulate your sleep again and go back to normal sleeping. Now you'd find, as I said earlier on, women have a problem with sleep because remember, part of their life in nurturing, they would have had to wake up so many times in the night to feed the baby and all of that. And so that their sleep could be disturbed. You also find that people who work shift, you know, there's a biological clock inside of us that normally makes us feel sleepy at a certain time. But when we have to work shift now, we override the biological clock, and then our whole sleep pattern goes haywire. So we need to fix back that. We need to regulate our biological clock. That is to say, if you have to come to work, you have to get up to come to work every day at 5 a.m. in the morning. You set your alarm. Well, you have to get up at 5 a.m., you set your alarm for 5. And even if you went to sleep at 3 o'clock, when the alarm rings, you get up. What will happen in 3 to 4 days? Your body is going to readjust. If you keep getting up at 5, you will see that your body, you'll start feeling sleepy around 9, 10 again. And when you feel sleepy, it does not matter how good the program is on Jagriti or whatever, please leave the TV and go and sleep. Sometimes we fight the sleep because we want to see the outcome of this serial or this show, and once we fight the sleep, in order to fight the sleep, the body produces its own stimulant. And now we have to wait another 4 hours before we feel sleepy again because we used up the natural sedative that the body had produced. So we have to, especially shift workers and people who having difficulty to sleep, this is one of the way of resetting your biological system so that you feel sleepy at a certain time. So that one can work, for instance, if you're working backwards from 5 o'clock and you want to get 7 hours sleep, you need to get to sleep by, you need to go to sleep by about 10. So by 5, you get your 7 hours, right? But let me say something about that again. Now, there are two kinds of sleep. That is what is called delta sleep, Jason, which is the deepest sleep, and that is just about 45 minutes. And then there's something called REM sleep, which is another 45 minutes. So basically, if a human being get 90 minutes of the delta and REM sleep, they can manage, they will survive. They, because I have not seen anyone death certificate, written that died from not sleeping. I have not seen yet. Although I know that over time, if you're not sleeping, your immune system is going to get compromised, your health is going to get compromised, and yes, it could lead to your demise eventually. But I want those people who, all right, as I said earlier on, you take a warm bath, you go to your bed when you start feeling sleepy, you have a little clock, or you could use your phone and just glance at what time you went to sleep. Because a lot of people, when they wake up in the night, they are disoriented. And if you suffer with insomnia, the first thing comes in your mind is, oh gosh, look, I just went to sleep and I wake up. It's still dark, I'm disoriented, and you start to become anxious. But if you saw you got your 90 minutes, you realize that, look, I will not die if I don't sleep. You hopefully will not get anxious, and you'll be able to go back to sleep. Now, again, there are some people who they sleep in a particular way. Some sleep on their left side, some on their right side. And some common sense things is, please don't drink a lot of fluids right before bedtime, because you're setting up yourself to have to wake up, right? And as I say that, it is also useful not to eat a heavy meal and then soon after go to sleep. It is best to have a healthy practice now emerging is that if you can have your last meal before sundown, that would be the best thing, to give the body sufficient time. Because one of the ways to put on weight is to eat and go and sleep right after. Okay, so you have your meal, you have your warm bath, you feel sleepy, you go to your bed, you assume your most comfortable position, and if you're not feeling sleepy, you would find that this is a form of simple meditation. When thoughts are coming in your mind, whatever is stressing you out coming in your mind, what one can do, bring your attention to your breath. And you'll notice once you bring your attention to your breath, observe how the air is touching the nostrils when you breathe in and out. You'll notice the thoughts will go away. Whatever stressful thoughts they are, once you bring your attention to your breath and observe the breath, the thoughts go away. And eventually, if you keep doing that, eventually you are going to go to sleep. Now, as I said, as we become older, we don't need as much sleep. So that 5 hours, 6 hours, 7 hours, depending on your activity level. I know I can get by with 5 hours very easily. All right. So that, again, there are some things that you need to, as I said, you need to monitor the amount of sleep you're getting. Now, common sense again will tell you if you sleep during the day, Jason, you will have trouble sleeping the night. A lot of people like to do a little cat nap during the day, especially after meals, when we after having lunch, a lot of times a heavy lunch, there's a tendency because all the blood is going down to the intestines to help us digest the food. So there's a tendency to feel sleepy, and we go and take a little sleep. But if you take a little sleep during the day, then you may have problems sleeping during the night. So if you are trying to reestablish a healthy sleep routine, what you need to do is to stop napping during the day. Avoid napping, so that when you go to sleep, you go to sleep. All right? And as I said, set your alarm clock and stick with that. Resolve to that. If you want to reset your biological clock to induce sleep at a certain time, then you need to wake up. Now, I can tell you, eventually, people with insomnia, If they leave the body up to its own devices, you are going to sleep. When you're sleep deprived, I have seen it generally. If you didn't sleep one night, two nights, by the third night, you can't stay awake. It doesn't matter who or what. Even people with insomnia. But that is not a healthy practice. Now, again I mentioned, I have been using what is called sleep therapy, which is all of these things that we've been talking about, you know, looking at what, if I were working with a patient who had insomnia, I would want to find out all of these stressors, psychological, whether they are psychological issues that the person is, stressing about, that is having the person disturbed, whether it be financial, whether it be psychological, whether it be relationship, um, rooted in a relationship problem, social problems, and so on. And then you develop a plan. Now, acupuncture has been found to help people with insomnia. In fact, let me just describe an experience I had. I had been part of a international visitors program with the US government and part of a group of people from all over the world. And we were looking at, that was way back in 1995. We were looking at the HIV epidemic at the time. And in the introducing myself to the group, I mentioned that I am an acupuncturist. Well, a lot of people from these other countries wanted to, some of them had heard about acupuncture, never seen it practiced and all of that. I had also mentioned to them that I practice a 12-step program. I live by 12 principles as a person in recovery. So when we were in Atlanta, Georgia, they asked me to do a presentation on the acupuncture and the 12-step program to the entire group, which was about like 120 people. We had gotten the conference room of the hotel, um, and I decided to do the presentation on acupuncture before. So I spoke about the use of acupuncture in the treatment of drug addiction, and I had worked with needles, and there are quite a number of people who wanted to have the experience. So I put one little needle on the air at a point called Shenmen, which is the point that relieves stress. Now, these were people who were living out of a suitcase. We had been on the road for the last almost 2 weeks until we came to Atlanta. And the problem is nobody could stay awake. All those people who had had the acupuncture on the airs were having difficulty to stay awake to listen to the other lecture. So I did not have to convince them how effective the acupuncture were in terms of dealing with things like insomnia and all of that. And that is the experience I've had with most of my patients who come to see me now, especially for drug addiction problem or for other physical problems. I treat people with stroke and people with depression and anxiety and you name it, because I'm professionally a counselor as well as an acupuncturist. And I offer acupuncture, auricular acupuncture treatment, because it brings the whole body into balance. So if you are anxious, it calms you down. If you are depressed, it brings you up, and it helps to deal with all the withdrawal symptoms I mentioned before. The irritability and the heart palpitations and the craving for the drug. It works for not only alcohol, but people with tobacco addiction, any type of addiction. The needles, unlike human beings, it doesn't discriminate. Whether you believe in it or not, it works. In fact, I am generally a very critical person. I don't. I believe I was born a critic. I don't accept things unless I see it work, and that was my first encounter with acupuncture itself. But having done the training, having interviewed so many people and done the research, I know it works now. I have no problem with it, and it has been used. We used to use it at Cora Hospital. It's still being used at New Life Ministries to treat people with drug addiction. And there are several practitioners who continue to do not only auricular, but generalized acupuncture. I do generalized acupuncture as well. So I'm saying it is not absolutely necessary. If a person follow what I'm sharing on this program. And of course, this is not a comprehensive treatment of the subject of insomnia. There's much more we can talk about, but the program only allows for a discussion of some of the main issues. However, if anyone having a problem with insomnia, they can contact me at 6713040, 6713040. And insomnia is not a problem, only associated with drug addiction. It is associated with human beings generally who can, for so many other reasons, have trouble to sleep. I'm sure every human being, including myself, have gone through periods of time when we're having trouble to sleep, because of some psychological issue, some problem that life is a one-time journey. So we are always going to meet situations for the first time as we go along this road of life, Jason. And some of them, because of experience and resources, we might be able to deal with them. But whenever we meet a problem that we have not had before, no experience in dealing with it, and a lot of us are, private people, as we like to say, we don't like to go with every little problem to anyone. We all like to be self-sufficient. And as a result, a lot of us suffer silently. And then sometimes we make the mistake in choosing the wrong intervention method. We may choose the right method, but we may overdo it, like I mentioned. We might be introduced to medication and then become dependent on it. And now having an additional problem. So that I have found a lot of people, having worked in the field of psychiatry and in private practice here, a lot of people who might have been introduced to a psychotropic drug, a antidepressant, a tranquilizer, anti-anxiolytic, sedative, for some situational problems that they might have had in the past. But then years after now, they're still using it, and they have moved and graduated as they develop tolerance to a higher and higher doses, more and more potent medicine, to the extent where now they can't live without it. And they can't live with it, and they can't live without it. I'm seeing quite a number of people like that. And I want to let those people know that there is hope, there is a way out. Once you have the desire to stop using the drug, because as I said, it is the same as becoming addicted to cocaine and alcohol and marijuana. People do come off those. You can come off your prescription pill addiction as well. All right? But it takes time. You have to have the determination. Once you have the determination, that is the desire to do it, I can show you how to do it. So I know whenever we get to talking about these things, Jason, times are out. But I'm so happy that this television station and this radio station allows us the opportunity to share this information. And this is only an introduction, really, to the subject. There's so much material available online now to deal with insomnia and to give, people good information about tips of how to help yourself if you having this problem. And for those who would like to, of course, they can call me, and I will be willing to guide them and, of course, provide them with the necessary support to be able to deal with this. So I want to thank you again, Jason, for having me on the program.
Yes, always a pleasure to have you on the program, and I definitely learned and appreciate the 5 to 7 hours sometimes I get every night. So it's a very interesting program, and of course, like Mr. Dwarka said, help is available for all those suffering from insomnia. And of course, until next Thursday, right here on the number one. Stay tuned then. I'm Jason Clue saying, see you around for now.